Welcome to our College of Nursing Hall of Fame celebration. This evening is such a special event for us. Of course, we would prefer to have had it as a face-to-face celebration, but we're going to celebrate with you virtually. Last spring, when we were planning to induct our 2019-20 inductees, we had to postpone the event, which was scheduled for March due to the COVID-19 pandemic. Well, here we are again in March, and we're having to decide to celebrate again virtually. So we didn't want to keep postponing things. So we're doing this celebration. It's just as important for us to do it virtually as it would have been face-to-face. Hopefully by next spring, you can join us for our Hall of Fame celebration, and we'll be able to do it face-to-face. And it'll give us an opportunity for you to connect with other Hall of Fame members that we've had throughout the years, and to welcome a new cohort of inductees. So tonight is really special, and we look forward to sharing this with your family and friends. It will be recorded so that you can do that in case they were unable to join us during this specified time. I'd also like to say a special welcome to our current Hall of Fame members. And thank you for joining us as we celebrate the successes of our new inductees. I also wanted to recognize Elizabeth Maxwell, who's our Director of Development for the College of Nursing with the Medical and Health Science Foundation. Elizabeth, I'm sure, has connected with each of you, and she assists us with this program, as well as Jane Boardman, who always plans such a festive event for us, and she's still working behind the scenes in helping us to design the program and plan the program for tonight. A special thank you to our IT staff, who have worked very hard during this pandemic to help us plan virtual celebrations, to help our faculty transition to all online. So it's been a challenging time for us, but we've learned quite a bit, and I think we're getting really good at doing these virtual celebrations. So we hope that you'll enjoy the event tonight. Just to give you a few updates about the College of Nursing, we are continuing to be a National League for Nursing Center of Excellence. We've received that designation for the 4th time. Our simulation labs also received accreditation, and we are the only UNC system school that has our simulation labs accredited, and they just do fabulous work with our students and faculty. So we're still making sure that we're preparing a quality education for our students. We were ranked by U.S. News and World Report in the top 20 for our online MSN program. Actually, we were ranked 17th, and then in the top 10 for some of our specialties. Our nursing education, our nursing leadership, and our accessibility to veterans were ranked in the top 10. So we're very proud of those national rankings that we have, which again attest to the quality of our programs. Our spring enrollment is the largest enrollment we've had in the College of Nursing, with 1,412 students. I continue to say this every semester. For the last 3 semesters, we've had a record enrollment. We have 100 more students than we had last spring. So again, we are focused on preparing a nursing workforce, which is much needed, as you are aware. But tonight we're celebrating our new inductees from both last year and this year. We have 10 inductees from last year as well as 12 for this year. And also we'll be recognizing our Distinguished Alumni from both years as well. To give you a little history about the Hall of Fame, we have raised $150,805 during the existence of our Hall of Fame for scholarships. And we've actually given out a little over $118,000 in scholarships for our students. So while not only are we recognizing the accomplishments of our great leaders in nursing, it's also a way of giving back to prepare a new nursing workforce. So I wanted to introduce to you Catherine Taylor, who's one of our Hall of Fame scholarship recipients, because she'd like to say a few words of thank you to each of you as she has received one of these scholarships.
Hello, my name is Catherine Taylor, and I'm a second-year PhD in nursing student here at ECU's College of Nursing. I was lucky enough to be one of the recipients of the Hall of Fame scholarship this year. In addition to being a PhD student, I serve as an ICU nurse here in North Carolina. Times have been very challenging, as you can imagine, during COVID-19, working as a nurse, also as a student. But receiving this scholarship has taken some of the pressure off of me, allowed me to focus on my studies, and continue working as a nurse. I want to thank the Hall of Fame members and the scholarship donors from the bottom of my heart for allowing me this opportunity and supporting me as I've continued on it in my educational career. Thank you so much.
So thank you, Catherine, for sharing your words of appreciation with those who've contributed to our Hall of Fame scholarship. I think you can see Catherine is one of our shining stars in the College of Nursing. So I wanted to just share with you a little bit about the award that you receive. You should have received this in the mail. It's a flame, a crystal flame, with the name and date on there. And it really reminds me of the pen that was developed by our first nursing students who began in 1960. As most of you know, this is our 60th anniversary of the College of Nursing. And so they said that this flame represented a vibrant life, and certainly our Hall of Fame inductees are indeed a vibrant life that have contributed so much to the nursing profession. So now I'm going to share with you the Hall of Fame recipients from first our 2019-20 cohort. And so I'm going to start first with Carol Cox. Carol is being inducted posthumously. Carol was a native of Massachusetts and graduated from Bay State Medical Center in Springfield, Massachusetts. She received her BSN from the University of Massachusetts at Amherst and a school nurse practitioner specialist certification from the University of Colorado. She held 2 graduate degrees from the University of North Carolina at Chapel Hill. She was really known as an exceptional leader in school health nursing. She worked tirelessly to make sure school nursing was promoted in North Carolina. She joined the College of Nursing in 1977 and taught pediatric and community health nursing. And while she was with us at the College of Nursing, she received a HRSA grant to develop a graduate concentration in community health nursing with a focus in school nurse leadership. She authored several publications and was a speaker at national and international conferences. In 2000, Carol received the Friend of School Nursing Award from the NC Nurses Association. In 2002, she was awarded membership in the Order of the Longleaf Pine, which is one of the highest honors bestowed by the Governor of North Carolina. She retired from the College of Nursing in 2002. So we appreciate so much the work that Carol did and appreciate her contributions to the nursing profession. Next, we wanted to recognize Donna Dorsey. Donna received her BSN degree from ECU and an MSN from the University of Maryland School of Nursing. She began her career in clinical practice at Greenbelt Convalescent Center, and then she worked as a community health nurse at Montgomery County Health Department in Rockville, Maryland. Donna then began teaching at the University of Maryland, where she worked for 5 years and served as the director of the RN-BSN program. Following this, she served as the executive director of the State Board of Nursing in Maryland for 26 years. She also served as the director of the Central Maryland chapter of the Baltimore Red Cross. From 2002 to 2006, Ms. Dorsey served as the president of the National Council of State Boards of Nursing. She was instrumental in the development and implementation of the computerized NCLEX, the establishment of a national and duplicated licensing database, the implementation of the Nurse Licensure Compact, and the initiation of the Commitment of Excellence project to promote ongoing effectiveness of nursing regulation. In recognition of her work with the National Council, she was presented its highest honor of the R. Louise McManus Award. Donna is a fellow in the American Academy of Nursing and a member of Sigma Theta Tau, as well as many other professional organizations. She's held numerous leadership positions, such as president of the Maryland League for Nursing, chair of the Northeast Regional Assembly of Constituent Leagues in NLN. She is a member and has served on many boards throughout her career. She's very active in the American Red Cross. She's presented around the globe in areas such as Switzerland, Japan, Saudi Arabia, and Wales on topics related to disaster nursing and practice regulations, as well as published in on these topics. She serves as the Eastern North Carolina Region American Red Cross Disaster Service Supervisor, and she received the highest American Red Cross Volunteer Award for her work with the Red Cross. She published the World Health Organization International Council Disaster Nursing Competencies. She continues to serve as a consultant specializing in nursing regulatory and policy development and leadership, as well as very active in the Red Cross. Next, I'd like to recognize Dr. Dan Drake. Dr. Drake is a graduate of ECU with the BSN, MSN, and PhD degrees. He currently serves as the Senior Vice President of Operations for the Vidant Medical Group and Vidant Home Health and Hospice, and is an adjunct faculty with our College of Nursing. In his current role, he provides leadership to over 1,000 staff, 400 providers, 9 hospitalist programs, 5 emergency department programs, 80 ambulatory practices, and 900,000 patient encounters annually, with an annual budget in excess of $190 million. Dr. Drake has a long career of creating excellence. His entire career has been dedicated to improving the experience of the patient, whether in direct patient care or as a health system leader responsible for creating excellence in systems and processes. He is one of the founding members of the Bariatric Consortium, which led to the formation of the National Association of Bariatric Nursing. This work positioned Vidant Medical Center to be selected as an ANCC Magnet Prize winner. Dr. Drake is a consummate professional and committed to his own trajectory of personal and professional growth. He has served in leadership roles in nursing, quality and operation, and has an extensive portfolio of publications and presentations, as well as research in bariatrics and patient safety. Next, we have Dr. Andrea Fuller. Dr. Fuller received the BSN degree from ECU, the Master of Nursing degree from the University of South Carolina, and the DNP degree from Vanderbilt University. Dr. Fuller is a family nurse practitioner with over 25 years of experience in varied clinical areas. She obtained the black belt in Lean Six Sigma in 2013. She retired from the U.S. military in August of 2018 as a major. Her students and junior officers in the military have always praised her for her mentorship and guidance. She not only served in the U.S., but also in Germany for 3 years. She then served as the Patient Center Medical Home Director at Irwin Army Community Hospital and the Director of Primary Care in Fort Riley, Kansas. Following this, she worked as a nurse practitioner in the Carrera Clinic Uniformed Services University of the Health Sciences. Since retiring from the military, Dr. Fuller has taught at the Medical University of South Carolina. Her nominator said she always has been a selfless servant to others and pushes others to reach further for their goals. Next, I'd like to recognize Ida Gaskell. Ida received the BSN and the MSN degrees from ECU and completed several hours of doctoral study in educational administration at University of Texas, Austin. Her nursing career began as a staff nurse in Wayne County Memorial Hospital and Morehead City Hospital. She then worked for several years in community health in various counties in North Carolina. Ms. Gaskell then moved into the nurse educator role. She taught at Craven and at Carteret Community College and then at ECU. She then moved to Mississippi, where she became the director of the Associate Degree Nursing Program at Holmes Junior College. She actually established this program, and they achieved their accreditation in their first 5 years, as well as a 98% pass rate during the first year. So she was quite successful there. So she was then recruited to be the director of Jefferson School of Nursing in Arkansas. Due to her extensive and excellent leadership skills, she became the director of nursing at Northwest Arkansas Rehab Hospital in Fayetteville, Arkansas. So this was a new hospital startup, and she did a lot to establish many of the policies and procedures, hired staff, and so forth there. After serving in this role, she moved back to Morehead City and has done quite a bit of work at Carteret General as a clinical coordinator. And then upon retiring, she then began working with home health and hospice so that they really coaxed her out of retirement so that she could work with them. And she now volunteers doing blood pressures, education, mostly for diabetic women, for 3 of the local churches since she has retired again. So we appreciate the work that Ida has done throughout the years to advance our profession. Next, we have Dr. Sharona Johnson. Dr. Johnson received the Diploma in Nursing from Rapid City Regional Hospital, the BSN degree from South Dakota State, and the MSN, Family Nurse Practitioner, and PhD from ECU. She began her nursing career in South Dakota, followed by 4 years in Arkansas. Then she began working at Vidant Medical Center in 1996, where she's worked in a variety of roles. As a staff nurse and as a nurse practitioner in the Division of Nephrology and Hypertension. She currently serves as the Director of Advanced Clinical Practice. In this role, she provides clinical oversight for more than 300 advanced practice providers at Vidant. She serves on numerous hospital committees and works in collaboration with various services and healthcare providers. She also serves as a research assistant professor at our College of Nursing. She is the preceptor and development coordinator for a $2.7 million HRSA grant to develop, implement, and evaluate individualized plans for preceptors accepting our APRN students in rural communities. She's a member of several nursing organizations, and several of those relate to her work in nephrology. She's a board member for the Center of Family Violence Prevention and also involved in numerous community activities. As a nurse scientist, Dr. Johnson has published articles and done scholarly presentations on kidney disease and dialysis. Her nominator said she is an exemplary model of a pirate nurse serving community and providing exceptional nursing care. Next, we have Beth Mahar. Beth received the BSN degree from ECU. She was the first ROTC nursing undergraduate, and she received the Distinguished Graduate from the Air Force ROTC, and when she was actually told it couldn't be done, because we know how rigorous a nursing curriculum is, and to be in the ROTC just adds additional work. She attended Air War College and the Air Command and Staff College at Maxwell Air Force Base in Alabama. Beth has had a diverse and varied career defined by her exemplary and extensive clinical, supervisory, and administrative experience. She served over 30 years in the U.S. Air Force Nurse Corps, culminating as a Reserve Colonel Mobilization Augmentee Medical Group Commander. Additionally, she served over 6 years in the U.S. Department of State Embassy Medical Unit Field Operations, including Regional Medical Officer Support, Medevac Coordination, Patient and Staff Teaching, and many other duties. Her military career included stints in Virginia, London, Australia, and Seymour Johnson Air Force Base in Goldsboro. Among her honors, she received the Department of State Meritorious Honor Award, the Department of Defense Meritorious Service Medal, the American Red Cross Volunteer of the Year, and the Wilford Hall Medical Center Nurse of the Year. Next, we have Dr. Dionna Martin. Dr. Martin is a graduate of our BSN program. She earned the Master's in Public and Community Health Nursing at UNC Charlotte and the PhD in Nursing from Catholic University of America. Early in her career, she worked as a staff nurse at Beaufort County Hospital, at Presbyterian Hospital in Charlotte, and Cabarrus Health Alliance in Kannapolis. She then went to Arlington County as a public health nurse in Virginia. In 2013, she began working for the U.S. Department of Veterans Affairs and served as the Associate Chief of Nursing Education and Research. She's currently the primary nurse consultant for the U.S. Government Accountability Office in Washington, D.C. Her scope of responsibilities reaches into healthcare policy research, interpretation of complex clinical aspects of federal health program policies, and provision of analysis from members of Congress. Her span of influence affects health care of all U.S. citizens. Dr. Martin has publications and presentations on topics related to health policy and community health. She's also a member of Sigma Theta Tau and was awarded the Sigma Theta Tau Top 100 Extraordinary Nurse Recipients. Next, we have Agnes Moore. Agnes received the BSN degree from ECU and also a certification for teaching in public high school. She's had an outstanding career as a nurse, a health occupations educator at Fike High School in Wilson. Ms. Moore was a master teacher model for the new lateral entry health occupation education teachers and received the Teacher of the Year and Outstanding Vocational Educator for several years. Agnes was the Nurse Aid Program Manager in the NC Department of Public Instruction. She is the current North Carolina representative in a partnership between the Department of Defense Education Activity and NC entities that offer approved nurse aid training and subsequent NNAAP certification testing to overseas high school dependents. The Department of Defense Education Activity is responsible for planning, directing, coordinating, and managing pre-kindergarten through 12th grade educational programs on behalf of the United States Department of Defense. She's been very active with the American Red Cross, where she was selected as a charter member of the top 5 regional sponsors club for outstanding contributions to the blood service program. And she received the most outstanding health and safety instructor for the American Red Cross. She also is a water fitness instructor at Rocky Mount YMCA and the Vita Edgecombe Pool in Tarboro. Next, we have Dr. Shannon Powell. Dr. Powell is an alumnus of the BSN, MSN, and PhD programs at ECU. Early in her nursing career, she worked at Chowan Hospital in Edenton, followed by serving as a school nurse in Bertie County Schools. She then worked at Pitt Community College and later joined the faculty at ECU College of Nursing. She currently serves as the concentration director for the nursing education concentration in our MSN program at ECU. Dr. Powell is an NLN certified nurse educator. Her current research includes school nurse interventions to promote health in school-age children, specifically related to mental health and nutrition. She also conducts educational research. Dr. Powell has numerous scholarly publications and presentations related to school nursing and to the school-age population. Her work has generated a significant amount of interest, and she's known as a national scholar in this area. She's a member of Sigma Theta Tau and Phi Kappa Phi Honor Societies and the National Association of School Nurses and the Southern Nursing Research Society. She received the Phyllis N. Horns Outstanding Doctoral Student Award in 2016 and the Daisy Faculty Award in 2018. Dr. Powell is the recipient of the 40 Under 40 Award given by the university, where she was recognized as a rising star. Now I'd like to share with you the Distinguished Alumni for 2019-20, which is Dr. Mary Chapman. Dr. Chapman is the WellStar Health System's Executive Vice President and President of WellStar, Kennestone, and Windy Hill Hospitals. She joined this organization in March 2017 as the Vice President and Chief Operating Officer. In September of 2017, she was then appointed as interim president while still maintaining her chief operating officer duties, and in March of 2018 was appointed as the senior vice president. In February of 2020, Mary was also appointed as the executive vice president of WellStar Health System while maintaining her duties as president of Wellstone, Kennestone, and Windy Hill. In this role, she manages a team of more than 10,000, including finance, human resources, nursing operations, and medical staff. Mary is responsible for collaboratively developing the vision and leadership for 5 hospitals, 4 health parks, and close to 100 facilities within Georgia's most integrated health system, while opening and managing the Southeast's largest emergency department. Before joining WellStar, Mary served as the Chief Operating Officer at University Health System, Memorial University Health System in Savannah, Georgia. And prior to that, she was at Vidant Health System, where she actually started as a nursing assistant and ended up her career at Vidant by being the Chief Nursing Officer before she moved to Georgia. Mary grew up and attended college at ECU, where she received her 3 degrees of BSN, MSN, and PhD. She's had the pleasure of serving on many local, state, and national boards, including being appointed by the governor to serve on the Board of Nursing in 2011, where she served for 2 years as the vice chair. She also serves on other boards. She's received numerous recognitions and awards. She was recognized by the MBA Diversity Magazine as a top 50 under 50 and recently featured in the Diversity MBA's Top 100 magazine Women of Influence inaugural edition. She was recognized in Women Worth Watching in STEM 2020 and recognized as a fellow in the Malcolm Baldrige program. Most recently, Mary was recognized as one of the 2020 West Cobb Citizens of the Year for serving on the front lines for Cobb County, fighting COVID-19 and working with local leaders. Congratulations to Dr. Chapman and all of our Hall of Fame inductees for 2019-20. I'd now like to recognize our 2021 Hall of Fame recipients, and we'll begin by recognizing Wendy Bridges. Wendy received the associate degree from Wake Technical College, the BSN degree from North Carolina Central University, and the MSN degree from ECU. She is a certified dementia practitioner and obtained the NIH Stroke Scale certification. Ms. Bridges worked at Vidant Medical Center for 32 years in a variety of leadership and clinical roles. While employed at Vidant, she was part of the team who helped perform the first open heart surgery. She was instrumental in laying the foundation for the certification of the bariatric program while she served as the bariatric coordinator at Vidant. She joined the faculty after her retirement at Vidant in 2015. She's really made a palpable difference in the College of Nursing climate for faculty, staff, and students. Through her scholarship, Wendy has added new strategies to complement student learning in her specialty area of med-surg nursing. She has increased awareness of the contributions of African Americans in the College of Nursing by establishing our annual Black History Month celebration, an event that educates and inspires all of us who participate. She's very active in the Diversity Advisory Council for the College of Nursing and serves as an advisor for the Multicultural Student Nurse Association. Wendy believes in keeping the community abreast of various resources and services. She provides health education to the greater Greenville community through her weekly radio broadcast called Family Health Matters. She hosts members of the healthcare community to share their experience with consumers about ways to embrace and maintain healthy lifestyles. Wendy was named among the Great 100 Nurses in North Carolina, received the ECU Sawiri Award, the Daisy Award, and the Health Science Author Recognition Award. She's also a member of Sigma Theta Tau, NLN, and NCNA. Next, we have Patti Hudson. Patti received the BSN and MSN degrees from ECU. She served as the past president of the ECU Nursing Alumni from 2002 to 2004. She began her nursing career at Vidant Medical Center and was there for 24 years in a variety of clinical and leadership capacities. She began her nursing career in the medical intensive care unit and then transitioned to being a systems analyst in information systems and then quality coordinator for the Office of Quality. She was responsible for coordination and implementation of quality programs for trauma and surgical services, emergency operative services, anesthesia, and the pain center. She also was responsible for helping to prepare for JACO. Patti then became the magnet director for Vidant Medical Center and was helping to coordinate the magnet designation that they received, their first designation in May of 2004. Following this, Patti served as the manager for several intensive care units and administrator for emergency services. She then became the Vidant Health Regional Manager for Workforce Management. She was responsible for 7 regional hospitals, ensuring nursing productivity, budget, and targets for nursing. She then worked as the Chief Nursing Officer at Vidant Beaufort. She currently serves as the Chief Nursing Officer and Vice President for Patient Care Services at Carteret Healthcare. She's very active in the community and has worked with multiple organizations, including churches and civic organizations, with community screenings. She is a member of the American Association of Nurse Leaders and participates at the state level with this organization. Next, we have Dr. Susan Kidd. Dr. Kidd received the BSN degree from Atlantic Christian, now known as Barton, and the MSN and PhD degrees from ECU. She's an NLN certified nurse educator. Early in her career, she worked at PCMH, now Vidant, and then Wilson Medical Center. She then worked as a public health nurse in Wilson County Health Department. Dr. Kidd then began a nurse educator role at Wilson Technical Community College and also served as an adjunct faculty for Nash Community College in Barton. She joined the faculty at ECU in 2007 and taught in a variety of courses in our baccalaureate program. She served as the director of our accelerated second-degree BSN option for 5 years and was instrumental in the curricular revisions with this program. She currently serves as the department chair for the Baccalaureate Nursing Education Department, and this department includes both our traditional BSN, our accelerated second-degree BSN, and our online RN-BSN program. Her scholarship has focused on factors contributing to clinical judgment development in nursing students during simulation and comparison of clinical competencies between ABSN and traditional BSN students. She's contributed to the personal and professional development of hundreds of our pirate nurses. Next, we have Marion Liner, better known as Diddy Liner. Diddy is currently one of our faculty emeriti, but Ms. Liner received the diploma in nursing from Watts Hospital School of Nursing. She then received the BSN degree from UNC Chapel Hill and a Master of Education from NC State. She worked as a staff nurse and then head nurse at Watts Hospital for many years. She then joined the ECU School of Nursing in 1968. During her tenure, she moved from instructor to associate professor. She taught med-surg nursing with a focus on neurology and intensive care. I can remember her lectures very well because she taught me. She is a member of Sigma Theta Tau Beta Nu Chapter. She received the honor of Who's Who in professional education. Ms. Liner really says she lived 2 lives, one as a nurse educator and one as a military nurse in the reserves. For her active duty, she went to other hospitals up and down the East Coast where they taught corpsmen, CPR classes, and opened clinics in various units. Ms. Liner was promoted to colonel during her stint in the reserves. She ran the emergency room for 6 months when deployed in Vietnam and then worked on the ward for 6 months. She also taught units that were going overseas during Desert Storm. She has received multiple awards during her 32 years of service in the reserves. The highest was the Meritorious Service Medal. She retired from ECU in 1996. Her nominator stated, "Her humorous guidance and confidence approach contributed greatly not only to my passion for nursing, but to my confidence and competence." Next, we have Sharon Millett. Sharon received the BSN degree from North Carolina A&T State University, the MPH degree from University of North Carolina Chapel Hill, and a postmaster's certificate in family nurse practitioner from ECU. She's also a certified dementia practitioner. Sharon began her nursing career at Pitt County Health Department. She then worked as an industrial nurse at Burroughs Wellcome. Sharon then worked as a nurse administrator back at Pitt County Memorial Hospital for 3 years prior to moving to Maryland, where she worked as a clinical manager of Montgomery Home Care. After 2 years, she returned to Greenville and joined the faculty at ECU in 1994. She's currently an associate clinical professor and teaches community health nursing in the Department of Baccalaureate Education. Sharon has also functioned as an APRN at the Women's Health Center of Greenville for her clinical practice. Ms. Millett is the faculty advisor for the Multicultural Student Nurses Association. She has continuously worked to improve the health of communities wherever she has taken nursing students for learning experience. As a co-PI on the AHEC grants, Ms. Millett worked with nursing students in other disciplines to teach them how to strengthen the communities they worked in and how to work better collaboratively. She was on the board for the Lucille Gorham Intergenerational Center and implemented the 2 AHEC grants there for nursing students to learn how to work in interdisciplinary teams as they set up a health clinic on site for use by all ages in that community. She's taken students to several health departments in the eastern part of the state to give students the opportunity to learn how to work effectively as both a public health nurse and as an advocate for groups in the community whose voices are often not heard. Advocacy is something she not only teaches, but she also role models to her students. Our next inductee is Marie McKinney. Marie received the Associate Degree in Nursing at Beaufort Community College and the BSN and MSN degrees from ECU. Over Marie's 23-year nursing career at Vidant Medical Center, she has partnered collaboratively on projects to enhance the quality of care and excellence in nursing in a variety of roles, from staff nurse, nurse manager, to administrator of patient care services. In her current role, she is the administrator for 279 beds and over 600 team members with the Academic Medical Center. Some of her achievements include the development of an adult special care unit to meet the needs of the organization in reduction of length of stay through clustering patients with disposition challenges. She participated in the development of the virtual workforce program for Vidant Health, which was a critical need during the COVID-19 pandemic. She's also led frontline care for the COVID-19 on the Medicine Intermediate General Unit. Marie led inpatient teams to enhance patient-employee experience and quality outcomes, being recognized through multiple venues. The Vidant Health Board Quality Award and a National Award for Achievement in Eliminating Hospital-Acquired Infections due to her work. Marie has partnered with many to support their dreams of transitioning across the spectrum in health care, from a nurse aide to a registered nurse, from a registered nurse to a nurse practitioner, to nurses advancing their educational preparation. So she serves as a mentor for many leaders as she is passionate about lifelong learning. Marie is a member of Sigma Theta Tau Beta Nu Chapter and the American Organization of Nurse Leaders. Her nominator said Marie is a servant leader who's committed to developing relationships that foster growth and innovation in the nursing profession. Next inductee is Monica Parker. Monica received the BSN degree from State College of Pittsburgh in Massachusetts and the MSN degree from Boston College. She is a certified diabetes educator. Monica first worked as a public health nurse in various locations, including Mississippi, North Carolina, Virginia, and Massachusetts. She then began teaching at Coastal Carolina Community College and then teaching at ECU. Following this, she became the patient education coordinator for the Department of Family Medicine and later was a clinical assistant professor in the Diabetes Center at ECU School of Medicine. She rejoined our faculty in the College of Nursing in 1991 and worked with us until her retirement. In addition to her teaching and work as a certified diabetes educator, Monica helped to develop the Mercy Clinic in New Bern, North Carolina. She collaborated with many service agencies in New Bern, including the Religious Community Services of New Bern. This is a nonprofit community clinic that's staffed primarily by volunteers, which provide free health care for adults in Craven, Pamlico, and Jones County who have limited income and without medical or dental insurance. She then utilized this clinic as a clinical site for our ECU community health nursing students. This was just an excellent opportunity for our students for their clinical practice in community health. She was frequently asked to guest lecture on diabetes in a variety of classes and in the community and at the state and national level. She's a member of Sigma Theta Tau Beta Nu Chapter and the American Association of Diabetes Educators. She served as a coordinator for the disaster relief victims at a special needs shelter and coordinated volunteers for the College of Nursing for this. Monica was recognized as an unsung hero by the North Carolina Medical Society in their journal. Next, we have Sandra Parks. Sandra received the BSN degree from NC Central University, the MSN degree as a women's health nurse practitioner from Chapel Hill, and the postmaster certificate as an FNP at ECU. She's currently enrolled in the Psych Mental Health Nurse Practitioner Postmaster Certificate at Frontier Nursing University. She received the Shepherd Award for Academic Excellence and Perseverance from NC Central University while a student there. Ms. Parks has worked as a women's health nurse practitioner at Chapel Hill OBGYN, NC Central University, and Women's Health Center in Greenville. She recently retired from the Pitt County Health Department, where she had worked since 2003 as a nurse practitioner. She also serves as adjunct faculty member and a clinical site evaluator for ECU College of Nursing. She serves as a preceptor for, or has served as a preceptor for nurse midwifery, nurse practitioner, and adult nurse practitioner students, as well as medical students and residents. She has been an excellent mentor and enjoys helping to educate new healthcare providers. She's an active member of the Koinonia Christian Center and is part of the First Responder Ministry. Now she's enjoying her new role as a full-time student at Frontier and also being a grandmother. Our next inductee is Sandra George Robinson. Sandra graduated from ECU in 1992. As an Army reservist attending ECU, she was mobilized to Operation Desert Shield. She quickly adapted to being in a combat war zone environment, and this interrupted her studying at ECU. Upon returning to ECU, she realized the transition back to civilian life was not really easy. She took the personal challenges and used her inner warrior faith and leadership qualities as a pilot nurse to graduate from our program. Her background has afforded her extensive familiarity with women's, veterans, post-deployment issues and their gender-specific healthcare needs. Sandra served in the Army Reserve, a 146th Transportation Unit, and deployed in theater during Operation Desert Storm. She received numerous medals during the years of duty that she served, to include the Kuwait Liberation Medal and the Southwest Asia Service Medal, with 3 Bronze Service Stars. While being deployed to war wasn't something she anticipated, the experience proved rewarding, leaving her with a profound sense of commitment to her sisters in arms. Since her departure from the active military service, Sandra has been a steadfast and devoted supporter of veterans and veteran causes. She is the North Carolina Ambassador for Women in Military Service for America Memorial, a VFW Lifetime member of the American Legion, and the military women across the nation. She serves on the boards of 2 veteran nonprofit organizations and is the co-founder of Desert Storm Combat Women. She served as state leader for the National Desert Storm War Memorial and currently acts as the American Red Cross Service to the Armed Forces Regional Women Veterans Outreach Lead for the Greater Carolina region. Also, Sandra is the co-founder and co-chair of the North Carolina Coalition of Women's Veteran Organizations. In 2017, Sandra founded Combat Female Veterans Families United. The purpose of this organization is to encourage and facilitate positive reintegration experiences for combat female veterans and their families through education, support, and advocacy. She currently serves as the organization's executive director. This organization serves as a partner on the National Military Women's Coalition Steering Committee. She serves as on this as well. Next, we have Dr. Christine Walden. Dr. Walden received the BSN, MSN, and PhD degrees from ECU, as well as a mini Master of Business of Administration certification from ECU. She achieved the Lean Six Sigma Green Belt and certification as a nurse executive. She's held numerous clinical and leadership positions at Vidant Medical Center, from educational nurse specialist, perinatal CNS, supervisor of case management services, administrator of patient care services, to the senior administrator of emergency and hospitalist services. In her current role, she has the service line with over 400 employees and 142-bed capacity with the main emergency department, minor ED, children's ED, and observation unit. She also serves as a clinical assistant professor in the College of Nursing, where she teaches human resource management to master's and DNP students. She was selected as one of the NC Great 100 nurses in 2017. She is sought by organizational, system, and national leaders for her expertise in engaging teams and leading mission-critical initiatives, utilizing change management strategies, empowering stakeholders, having a keen attention to detail, and fostering interdisciplinary communication and collaboration to enhance safe, quality patient care. Dr. Walden has published on a variety of clinical topics and provided numerous scholarly presentations at the local, state, and national level. She is a board member at the Center for Family Violence Prevention. Next, we have Kathy Williford. Kathy graduated from ECU with the BSN degree in 1976 and the MSN degree in 1988. She worked as a med-surg nurse at Edgecombe General Hospital early in her nursing career. Then she taught at Edgecombe Community College. In 1999, she became the director of the NEWH Nursing Consortium, which stands for Nash, Edgecombe, Wilson, and Halifax counties. This was the largest ADN program within the state and graduated consistently high-quality nurses. She encouraged all graduates to continue their nursing education, seeking a BSN degree or higher. When the consortium was dissolved, she returned to Edgecombe Community College and served as the director of the ADN program there until 2015. Among the honors and awards that she has received, she received the Edgecombe Community College Educator of the Year, the North Carolina Associate Degree Council Educator of the Year. She was inducted into the Great 100 of North Carolina Nurses and a recipient of the Order of the Longleaf Pine. In recent months, Kathy has made over 1,200 masks for healthcare workers. Any monies that have been made from this have been donated to SPOT, which is an organization to assist marginalized populations. Our final Hall of Fame recipient for this year is Jeannie Yacht. Jeannie received the BSN and MSN degrees from ECU. Early in her nursing career, she worked at Beaufort County Hospital and then at Washington City Schools as a school nurse. She then became a faculty member at Beaufort Community College. In 1974, Jeannie joined the faculty at ECU. She taught psych mental health nursing and later served as the RN-BSN director. Following this, she became the director of undergraduate student services, where she served in this role for several years. She served on a variety of committees during her career at the College of Nursing. Jeannie was the advisor for the Nursing Student Organization for several years and assisted them with community service projects. During this time, ECANS was the outstanding leader at the state level. After retiring, she returned to set up the School of Nursing Advisory Center, and our school was one of the first professional schools, or was the first professional school on campus to set up an advising center. She then returned to teaching psych mental health part-time until December of 2012. Jeannie has also served as a consultant at primary care offices seeing clients with mental health issues. She continues to be an active member in NCAA. She resides in Washington and is enjoying her two grandchildren during her retirement years. Our final honoree for tonight is Dr. Kim Hardy. Dr. Hardy is the Personal Health Division Director and Director of Nursing for the Pitt County Public Health Department in Greenville, NC. She completed her BSN, MSN, and D&P degrees at ECU. She's worked in public health since 1995 and has made several contributions to public health and the nursing profession over the course of her nursing career. Dr. Hardy has been the Director of Nursing since 2017 at the Health Department and has a determination and passion for ensuring that all patients have access to quality health care services and that they are treated with dignity and respect, irregardless of their socioeconomic status. Dr. Hardy was originally employed as a public health nurse in the child health program and continued providing medical care for patients participating in the child health and women's health programs after completing her advanced practice nursing licensure. While pursuing her MSN, Dr. Hardy worked as a child health consultant and successfully wrote 10 grants that were funded to improve the health and safety and nutrition practices in 6 child care centers in Pitt County. Her work in the local health department clinics and prior experiences in outpatient clinic settings has helped Dr. Hardy understand the patient, provider, and system-level barriers that prevent patients from receiving the needed health services. After completing the Duke Johnson & Johnson Nursing Leadership Fellowship in 2013, she began implementing quality improvement projects to address barriers to care that resulted in improved access to immunization services, quality of reproductive sexual health services, and other services needed by clients. In 2014, she began working to secure the first private third-party contracts for Pitt County Health Department. The agency has received over $218,000 in revenue as a result of her acquiring these contracts. As a nurse administrator, Dr. Hardy has provided leadership in public health disaster response by coordinating preparation and scheduling of nurses and support staff of the American Red Cross shelters in Pitt County. During this COVID-19 pandemic, she's implemented the Pitt County Health Department Community Testing Project, which to date has tested over 8,000 people. Dr. Hardy has a passion for supporting and educating the public health and advanced practice nursing workforce. For 7 years, she has served on faculty as a clinical instructor for community health nursing students and as a mentor through the ECU e-mentoring program for nurse practitioner students. Since 2018, she has served as a project coach for Duke Johnson & Johnson Nurse Leadership Program. Through her work with this program, Dr. Johnson has provided leadership to advanced practice nurses implementing projects to improve quality of health care services across the United States. Twice a year, Dr. Hardy co-teaches the curriculum Principles and Practice of Public Health Nursing, co-sponsored by the UNC Gilling School of Global Public Health and NC Public Health. Dr. Hardy has successfully advocated for policy change in local government regarding filling vacant public health nursing positions. In 2019, she was inducted into the College of Nursing Hall of Fame and recognized for her work as an exemplary leader. She currently serves as an adjunct faculty for us and is also the chair of the Eastern Region of the North Carolina Association of Public Health Nurse Administrators. In October 2020, the North Carolina Public Health Association awarded Dr. Hardy the Margaret Dolan Award, which is awarded to nurses with a commitment to quality nursing care and excellence in public health nursing service. She is a member of Sigma Theta Tau, the NCNA, American Academy of Nurse Practitioners, the North Carolina Association of Nurse Administrators Governing Board, and the North Carolina Public Health Association. So now join me in congratulating all of our Hall of Fame inductees and our 2 distinguished alumni. It's a real honor to be able to recognize the great commitment that these professionals have had to our nursing profession and the impact that they have made. Congratulations to each of you, and thank you for joining us for our special Hall of Fame event this year.